I hope that we can arm patients with the information they need to take care of themselves at home. So we know, of course, everyone is going to need to come to the doctor, or, you might end up in the emergency department and have a hospitalization. But for the most part, I think that the information and the care is available for people to largely remain at home where they're comfortable.
Welcome to the Move to Value podcast. In this episode, we pick up our conversation with Emily Volk from Northern Regional. This time focusing on how her team is navigating the red tape of Medicaid managed care. Emily breaks down the early headaches of documentation, how they're solving for care continuity, and why their top priority is automating the noise so teams can focus on what matters. We discuss the early frustrations of manual reporting, why partnerships like Chess have been game changers, and how technology and teamwork are improving patient outreach. Okay, Emily, thanks for sticking around to continue this conversation. I want to touch on an area of expertise for you, and that is documentation. Have you had to change any clinical documentation practices or care pathways to better support the Medicaid managed care reporting requirements?
So initially, yes, this was a really heavy lift because there was not really clear guidance from the health plans as to how we could report. And so it was very clunky. We'd receive patient lists of our attributed patients, and there were data points that we needed to gather. And so we could gather those internally, but then we couldn't transmit that back to the health plan very succinctly. So it was a lot of manual work in the beginning. And so that was really taxing and very frustrating, to be honest. However, now with the help of Chess, that burden has really been lifted. And so, we built some note types in our medical records system. We built some templates and then some communication pathways for the Chess care coordinators to communicate with our providers or with the clinical teams. That's simple. And I'm really looking forward to the partnership with Chess in helping us with reporting this data, because that, I think, was the biggest struggle that we encountered. So that has been a really, really huge benefit to us.
Well, that's great. I know that can really be a complicated mess at times.
Yeah, it's terrible.
Well, in what ways has managed care improved or complicated the continuity of care for your Medicaid patients?
I think it really has improved communication because patients have a point person who can get in touch with their provider pretty directly. And so that is going to help us to meet the needs of our patients, and then knowing who our patients are. So one thing that is a benefit is the health plans let us know, these are your enrolled patients. This is who you are responsible to coordinate care for. And so it helps us to identify and to do proactive outreach with those patients. So before, we didn't really have a good way of knowing who all of our Medicaid patients were. And then with expansion, we were concerned about assuring that we were able to serve the Medicaid patients in our service area and our population. But having just a little bit more clear information, a little bit more clear data has helped us to identify those that we serve.
Speaking of those you serve, what systems do you have in place to track whether those patients are getting the preventative and follow-up care that the managed care is designed to promote?
So we use the same systems that we have previously for all types of patients. So we're really fortunate in our electronic medical record. We have some templates in there or some systems that can capture when patients last, for instance, had their mammogram, or when they had their annual physical or their vaccines or something like that. And so it helps us to be able to keep up on that. And then we have in our department, our care coordination department, we have just some phenomenal folks who track that information for us and then get it back to the provider. We really make strong efforts to get that information to providers ahead of the patient visit, so that we know when that patient comes in, we know, okay, they need to have their A1C checked to see how their diabetes is doing, or they're due for their tetanus shot, or, whatever other preventative care we can give to them. And so some of that is manual, but a lot of it is teed up for us in our electronic medical record. And I cannot underestimate the help that having Chess as a partner has brought to the table. The data that they give us, and care gap data is so valuable. And then we, of course, validate all of that, but having someone hand us a report that tells us here's what's missing is just so helpful. It's something that we would have had a hard time doing ourselves, even with our electronic medical record.
Well, as my mom always says, many hands make light work.
That's right. So, exactly right.
Well, I know it's early, but are you seeing any differences in health outcomes or patient satisfaction since the shift to managed care? And if so, what stands out to you?
I think it's too early for managed Medicaid, but I definitely have seen differences in health outcomes for the other patients that we participate in managed care for, or value-based care. We can point directly to less hospitalizations for patients. We do every month we have a high utilizer review. And so those high utilizer patients who are having frequent emergency department visits or frequent hospitalizations are on our radar. And then we as a team work together to figure out how can we connect them with care, because these hospitalizations are occurring in between these doctor visits. So how can we connect them with care to avoid having them have that high utilization? So I do anticipate for our Medicaid population, we're going to see the same. We'll see less hospitalizations. We'll see less emergency department visits. We'll see more access to medication, really more participation in their own health care, and being connected with their provider, communicating with care coordinators, just receiving the resources that they really need in order to stay home and stay healthy.
Well, that's definitely a good thing. How does managed care allow, or perhaps limit, your ability to address complex needs? I mean, we talk a lot about mental health. We talk a lot about substance use and housing instability right now in our country. And I know that that's a big determinant. How are you approaching this?
So we struggle, just like everyone else. There is a terrible shortage of mental health professionals. We experience that pretty acutely in a rural setting. And so having access to social work through our partnership with Chess, and then our monthly care coordination meetings where we talk about specific patients and how we can help them, really allows us to address those complex needs. And I think just having more people at the table, and having the history and experience of those people that are at the table helps us to see things, or discover resources for our patients that we may have known nothing about because we haven't experienced that. So I think also the demographic variety in our teams is really helpful, because there are resources that may be available in an urban setting that we just don't have, But it kind of opens our mind to, okay, how could we replicate that? Or how could we access that maybe in our area? Maybe there's something virtual we can do. So just having, more brains focused on these complex issues and complex needs that our patients have is really helpful. I will say that we have a great relationship with many of our community partners, like our EMS folks, our substance abuse folks. We have some clinics that serve low-income patients here in our area that we partner with. And so having a lot of community involvement has helped because that gives us some really right here local resources that we can tap into.
That's wonderful. Well, tell me what your top priorities moving forward in terms of expanding or improving Medicaid managed care and value programs at Northern. What's on the horizon?
Well, we have always been pretty progressive as far as pursuing a technology solution. So I want to automate as much as we possibly can. And, there's a little voice in the back of my head that says you're going to automate yourself out of a job. And maybe I will. I think that's coming probably for many of us. But the ability to reach more patients and see through data the impact that we are having is really one of my top priorities in moving forward with improving managed Medicaid. And so we really try and leverage data and technology as much as we possibly can so that we can spend more energy on communicating with our patients and on giving compassionate care. The less time we have to spend looking through reports and tabulating data, we can call patients and we can help connect them with, a ride to come to see their primary care doctor, or we can educate them about their stroke risk factors. There's so much that we can do personally if we don't have such a tech burden. So that's really been a push for a long time for me, is to figure out how can we automate all of this stuff that we need to gather and report so that we can really focus on patients.
Again, that would be a wonderful thing to see.
Yes.
That can eliminate a lot of the confusion. Would be very helpful, because obviously we're all here to care for the patient and make sure that they have optimal help.
Yeah.
Well, tell me now that you've gotten, the 101 courses out of the way and the virtual meetings and all of these other things that probably you don't have much time to do during the day. What have you seen, just from top of mind, that if you could change or improve one part of the Medicaid managed care model, what would it be and why?
Less bureaucracy. I think it's this way with any managed program where there are a lot of people that you've got to report to. There's a lot of different entities and there's a lot of hoop jumping. And so I would love if there could be less of that. If everything was done the same by each payer and you report the same way, there's been the rollout. I think anyone who participated in the early days of Medicaid managed care felt like it was extremely confusing because there was a different ask from every health plan. And then, just figuring out how to get information and get it back to them. So I would say less of that, less of the confusion, less of the bureaucracy. It's been really a struggle. Even now, we struggle with this to know who our patients are, who's assigned to us, and to get a good, clean patient list. So I am looking forward to, once all of these kinks get ironed out, just a much smoother process of understanding who our patients are so that we can get started taking care of them.
Yeah, that's sometimes not knowing is a challenge. Well, so Emily, first off, as a nurse first, And then as a director of quality and risk and compliance second, which I'm not sure that that's necessarily the case, but I feel like it is after knowing you for a little while. What's your biggest hope for how Medicaid managed care can improve patient outcomes?
I hope that we can arm patients with the information they need to take care of themselves at home. So we know, of course, everyone is going to need to come to the doctor, or, you might end up in the emergency department and have a hospitalization. But for the most part, I think that the information and the care is available for people to largely remain at home where they're comfortable. And so I think we see a lot of utilization of care that we could probably avoid if we just communicate with patients, give them that compassionate care that they need, and then touch base in between those doctor visits. And I think that's the whole goal of managed care. We get preoccupied with a lot of, what do we have to do and who's got to do what and how do we report it? We get really distracted by all of those logistics. But I really hope that we can give patients what they need in order to take care of themselves.
Awesome. Is there anything that I haven't asked that you feel would be meaningful to this conversation?
Not that I can think of. We've covered a lot of ground today.
We certainly have, and I appreciate your time. So, Emily Volk, thank you for joining us today on the Move to Value podcast.
Been my pleasure. Thank you for the opportunity.
This has been the Move to Value podcast, powered by Chess Health Solutions. We hope you have enjoyed this episode. If you would like more information about this and other episodes, you can head over to movetovaluepodcast.com to check out all of the available resources. If you're interested in continuing to hear about value-based care and how it impacts you, you can sign up for our email notifications or subscribe to this podcast on your favorite podcasting platform. Also, we would love it if you would share the Move to Value podcast across your networks and leave a rating or review. Thanks for listening.